Thank you very much for inviting me. Now for something completely different. So I work for Young Lives. Young Lives is a collaboration. Its sort of organising node is in ODID, International Development Down the Hill. We are rooted in social science. We draw on economics. We draw on, to some extent, public health, but particularly anthropology, sociology, microeconomics. So this will be a little bit different. What I'm going to talk about, as has just been very nicely introduced, is a little bit of our experiences around trying to look at the research that we have, the evidence that we have, trying to think about what change we're trying to affect in the broader world, and our experiences of trying to do that. I will talk... 2 minutes. Do stop me if I'm prattling on too much. 2 minutes of background, there's a challenge. So Young Lives is a cohort. It's an observational cohort of children growing up in 4 countries: Ethiopia, India, Peru and Vietnam. We have been operating since, well, first data was collected in about 2002. So we've been operating for a number of years. It came to Oxford in about 2005-06. What we're doing is we are an observational cohort following 2 cohorts of children as they grow up. At this point, the younger group of cohort, the younger group of children, well, when data was last collected, were about 15. The older group were 22 in young adulthood. And we followed that younger group since infancy, the older group since they were about 8 years old. Our focus is child poverty. It's to try to understand what's going on in those children's lives and trying to inform policies and practices that could improve their later life chances. So that's a big mandate. It's a complicated one, many different things that have to do with child poverty. We are a data collection exercise at our heart, and we're collecting data, survey data, on children, their families. We're collecting data on children in their schools, and we also have qualitative data. And the survey data is publicly archived, so we are trying to create a platform for the use of others. And the experience of observational cohorts is that they pay off over time through unanticipated research questions, through people using things in lots of innovative, different ways. It's quite interesting to think through what the impact implications of that, given that you don't know what will happen in the future, might be. And just to say, we're a collaboration. I was really struck by what you said. You said that on your first slide, things that you've had concerns about in the past were wasting people's time. This study is highly reliant on a huge amount of information collected by people who give a large amount of their time being interviewed. And I think it's really important to recognise just how much that is entirely reliant on their goodwill, and that, I think, creates a responsibility on all of us. Right, I'm not going to go through this, but it has come out rather better than I expected. I thought this was going to be very blocky. I'm going to go through this at headline level only, but don't worry, I'm not going to go through any of the detail. This is our programmatic theory of change. At the back end of this slide is a few web links if you are interested. This stuff with the narrative that goes around it is online. But what I wanted to do was give a bit of an overview of, in a sense, how we see the world, how we're seeking that our activities may lead to positive change for children. Theories of change are really well debated. I'm sure that you will all have come across them and indeed be thinking or engaging in debates about them. For me, they're a good tool to think with. I think there's a risk in getting stuck in lots and lots of detail, but if they prompt you to think about what assumptions you are making in terms of how the work that you are doing leads to some kind of positive change, then I think they have a real role there. Enough. So, our theory of change. 4 channels of impact. I wanted to kind of highlight that just in terms of thinking about what we mean by impact, that it's helpful to kind of value all of the different things that we're doing and to also see the linkages across them. So 4 things highlighted in our theory of change: capacity development, how we hopefully through our activities across the collaboration within the countries, our study country collaborators within Oxford, we are hopefully creating capacity which can help long-term and beyond the life cycle of the study. Research, we're collecting and creating new research on a variety of different topic areas. Uptake, we're engaging in a range of different audiences, really quite a lot of different audiences, both at the national and at the global level, to try to ensure that our research reaches the right places. And innovation, always worth capturing that. A lot of methodological things of interest are worth noting and articulating because of how they may lead to later changes in the future. But very interesting question about how you move from the point of the activities, the activities over which you have direct control, to ones where you do not have direct control and where you are very hopeful for and where you will work very hard to try to engage, but where it is reliant on a complicated, complex world of other pressures and other people's agendas. So here, just moving from left to right, I think, as you see it. Here we have inputs, outputs, outcomes, and impact. I think I basically, though, simply wanted to put that slide up with a little arrow across into saying, well, if you're thinking about pathways to impact, there's a variety of different forms of information you can collect on that route, some of which you have a greater degree of control over than others. Just relying on impact is great if you have a real wonderful success story, but that's often reliant on many different things, and it's important to collect the whole piece in terms of trying to tell the story of how your activities led to some kind of positive change. A couple of quick examples, which I will rattle through. I just wanted to use 3 quick examples. We have loads of these. If you're interested, we've got a number of case studies that are written up and on the website. I won't bore you with chapter and verse, but I wanted to draw some messages or whatever out of some of our examples. First, I've mentioned capacity development. I think that's really important in the context that we are working in. Longitudinal studies require a huge amount of time and effort over many years, and that gives us real opportunities in terms of trying to support a process, a collective process of capacity development across the study in all of its areas of operation. One thing that has been quite exciting, I think, has been the emergence of a kind of institutional base for activities that aren't to do with young lives necessarily, but which come a little bit out of it. A recent example is the Ethiopia Centre for Child Research, which is an institution newly created. It has had previous incarnations. That originally, the idea for that came from a piece of work which drew stakeholders together within Ethiopia, and it identified that those stakeholders, researchers, people involved in NGOs wanted to talk to each other, and they didn't have good places on a regular level to do so. There was national demand there. And that slowly became a kind of forum that met regularly, and now it's moved into an institution which UNICEF fund now, and hopefully that will lead to a greater base for focus on children in Ethiopia. I think it's really important, but it wasn't quick. It required quite a lot of time and investment in terms of trying to make sure that it held together. But I think that's really exciting for the longer term. Second example, working with intermediaries, not feeling you have to do absolutely everything yourself. We work quite a bit with different bits of UNICEF. I wanted to highlight some work that was done by colleagues looking at violence affecting children, where we were able to use some of our quantitative and qualitative work to inform that, and where there was quite a lot of national work in some of the Young Lives countries and some other countries as well. That was very closely orientated with UNICEF's Office of Research based in Italy, and with UNICEF country offices. I think it's kind of important to focus on the role of others in this process and how you identify who those might be. It expands our own capacity. For us, this was very helpful in being better attuned to the audiences, to what other people actually needed to know. But you need to be flexible in terms of how you're working, and that's not always easy for any of us. By flexibility, I mean being able to respond quickly, being able to use language sets that other people use also. 3, a story about policy in early child development. This is some work that has been going on in Ethiopia over the last couple of years. So initially, We wanted to look at early child development services. The reason we wanted to look at that is because they weren't very common. Preschool interventions were not very common in Ethiopia, yet they're generally regarded to have a huge amount of promise for boosting later life chances, school readiness, other things like that. We planned that project, and then it turned out that there was a big policy opportunity. The government in Ethiopia actually had recognised and wanted to begin in different ways to invest in this policy area by putting what they call a zero grade, an additional grade below the formal school starting age. That created a huge opportunity, but it meant we needed to change our plans. So there's something about being flexible to opportunities, and I think there's also something about the kind of relationships that are involved in that process. There's been a lot of close working with government people, but that also has meant we've had to listen to what they're very interested in. And it's taken us away from our original research design. It's actually got us looking at issues of implementation. And there's a question. It's not an answer, it's a question about how far you stick with your original research question and how far you look at what the demand for that in the area is and respond to it. But a few common messages. First, research and policy cycles are different. Research takes ages, policy happens very quickly, opportunities come and go. They're different. It's a tension that we all live with. Relationships absolutely central. And planning for serendipity. You used the word in a different context, serendipity, earlier. Certainly a lot of this happens through luck, being in the right place at the right time, an opportunity opening up. But there is something about being in that place in the first place. So I think there are things you can do to increase the chances. Final slide. A couple of quick reflections. First, different types of impact, categorising impact. Again, I think this is just useful in terms of thinking. The first category, well, I put three categories down there. First, capacity, change in individuals' ability to do things across the project. There's lots and lots of capacity examples. Instrumental, change in the law, policy, delivery. That's really hard, and it's a question that we often get asked. Well, what was the direct result of this research? As you all know, it's not straightforward in practice, although we have some quite interesting examples. Conceptual change in debate. As researchers, I think that's one that's really fundamentally important to us. It has to be said. For some of our donors, they're much more interested in what they see as a really practical, measurable, smart, whatever change. But in terms of the conceptual point, I think we have to some extent to hold on to it. Where we try to make the case for that is by identifying big picture conceptual shifts and the number of people who could be affected by a change, the consequences of a change here. The example that I quite like here is adolescent nutrition. That our study identifies a degree of promise in adolescent nutrition, and there are a lot of people who could be affected by that. Being able to articulate that at least strengthens the case for more conceptual changes, in this case investments in nutrition beyond the first point of life. Planning for serendipity, increasing the chances of impact. I think my starting point here is what is the change that is needed, which is a kind of obvious question, but is sometimes really rather hard to answer. I find it hard to answer. Having thought that through, who can affect it, what is needed and when, what is the types of products, the timeliness of those products, when do they need that sort of information? Flexibility to opportunities, I've talked quite a bit about that, I think. Some questions about assessing impact. A couple of points. Attributional contribution. I prefer the word contribution. Attribution, I think, is quite difficult. How do you say that some change happened and a particular set of activities definitely led to that change happening? I think that is a challenge on a number of different levels. It's certainly a challenge to robustly demonstrate that. I think it also potentially overestimates the role of research and underestimates the role of political processes, other activities that are going on. When impact happens versus when you need to report it, that's a real-world challenge for us, that we report on an annual cycle, yet the results of these sorts of pieces of work may pay off over a number of different time. over a much longer period of time. And verification. How do you build a sufficient evidence base to demonstrate a kind of contribution? My final point is just to illustrate our approach to that, which is to look at impact case studies, to draft impact case studies. I've mentioned that we've I think got about 10 on the website. If you're interested, have a look or ask me. What those actually do is they tell a qualitative story. They tell a story about the context around the sorts of change that we were hoping would see, and they're supported by indications from documentary work where things have been referenced, those sorts of things. And we support them with qualitative case studies, with quotes from people, ideally from policymakers or from civil society people. Actually, it's a lot easier to get quotes from other researchers, but it has more power when it comes from that kind of policy-making nexus. But we use qualitative evidence, and we ask people, well, how did you use our work? What did that lead you to do differently, to think differently? And I suppose the other learning that we come up upon is there's lots and lots of this information, but it requires careful logging, and we're not always brilliant at doing that. An example comes up, you move on to something else. Logging that information as it's coming up makes it an awful lot easier to document it when the time comes. Enough from me. That's some links of things that may or may not be of interest. The first three are things on the Young Lives website, our theory of change and impact case studies, which have been written to describe some of the impacts that we feel we have or are having. And a couple of other blogs, a couple of other links, in case you're interested in having a look at this sort of stuff. This is from a very much social science kind of background, I think, but the impact of social sciences blog I find quite useful, interesting, and DFID's research uptake guide, because it went across my desk yesterday. Enough from me. Thank you.